future. You what God designed, God designed. Hello, good afternoon, good morning, board buddies. What's going on? Hey. We got a very special guest today, y'all. Get straight into it. I got the modern vet, Dr. Elan Armstrong. Did I say that your name right?
Yeah, Dr. Elan Armstrong. That worked.
Yes. Oh, she's a very accomplished, highly esteemed, very enthusiastic about learning and knowing the science, the veterinary information. She even has her own YouTube channel where she educates and goes over the North American veterinary licensing exam questions and information. She also is an owner of a Corso and a Boerboel puppy that she brought in at the same time, raised two puppies. So she's going to give us her experience on that. And I'll let you tell everybody about yourself. But thank you so much for joining us. Really appreciate having you here.
Thank you. Thanks for having me.
Yeah, so tell us a little bit about how you end up being emergency veterinarian.
Yeah. So actually, before I graduated vet school, I wanted to go into lab animal medicine, become boarded there, or pathology. But once COVID happened, it changed my course, just like I know it changed a lot of people's courses. And so I ended up, being thrown into, okay, I got to just start clinically. I don't have any time to do any additional training after vet school. So what is it going to be? It's either going to be general practice for me or emergency medicine. And I'm not a general practice person, so that's akin to like family practices, right? General practices. So I'm gonna lose my mind if I do that 24/7. So emergency medicine was the next best thing because it's just so exhilarating. It's, just high energy, just like with human medicine, right? You just never know what's going to come through the doors. And because of all the puzzle pieces that I have to put together, and again, just the adrenaline rush, I'm like, let's just try this. Let's see how I do, and then take it from there.
Wow, yeah, that's deep. That's deep. I can definitely go with that. Spontaneous, that adrenaline rush. The fact that it's always something different. It keeps it interesting. It keeps it challenging, and it's never a dull moment. So I could definitely understand that. And that's a really important job too, because a lot of times if we have an emergency situation, we depending on you to save our dog's life.
Mm-hmm.
And I mean, you know how serious that can be, because it's like, at this point, I'm the type of person that I'm only going to bring my dog to the vet when it's an emergency.
If you have to, yeah.
Right. Because I'm trying to do everything that I can to soothe them. And then I'm very observant. So when I see smallest change, I'm trying to address anything that's inconsistent.
Absolutely.
So, tell us a little bit about the Modern Vet channel.
So I started that channel during COVID. I feel like a lot of things were birthed during COVID. And the idea was, okay, I'm fresh out of school. I still have a lot of energy. How can I help other people? As with this licensing exam, because I know a lot of my comrades, struggled with it, and not everyone passed in the first try, which is not unheard of. Like it happens just like any other exam. So I was so thankful that I passed it on my first try. Trust me, God, thank you. Because I could have been one of those who didn't make it. You know what I mean? But obviously you have the opportunity to take it again. So it's like, let me just try to help people. What worked for me? Maybe it'll help them. And I tried to do it in a way that it wasn't like copy and paste, like how, you'll go to different programs and they have this very strict standard way of presenting things, which is there's nothing wrong with that. But what if there's another way to, help someone, teach them, explain things? So that's kind of the premise of my channel. And every now and then I'll kind of branch off and talk about different things that a new graduate would appreciate. So it's been a while since I've made a video, but it's on my to-do list.
It's tough. Trust me, I already know it's a lot to keep up with. But I did find it I was looking at your channel. I was going over some of the information, some of the scenarios. and I thought that that was really interesting and informative.
Mm-hmm.
I think that it was a situation where the dog's nose was all crusted up, and they came in. It was a lesion, and then you had a scenario where you could give it a antibiotic. You had two different kinds. You had an antibacterial and an antifungal.
Mm-hmm.
The appropriate treatment was for the antifungal, and that was really interesting. I'm a
Right.
I'm a student, so I'm always willing to learn.
Ah, okay. Yeah.
And I saw that you could take. I was like, wow, I could study for this North American veterinary licensing exam, and I could just take the test, and then I could be a vet. But it wasn't that simple.
Yeah, they have questions on there with just really like head scratchers because yes, it's a lot of small animals, so like dogs and cats and your farm animals, like your large animals, typical cows, goats, blah blah blah, all that medicine. But then they'll throw in the fish, and I'm not downplaying fish aquatic medicine because it's very important. But so yeah, you got to study everything, everything.
Right. So how different is that when you're going from mammal to mammal? Is it or bird to mammal? The anatomy, I know it's got to be quite different, but
Yeah.
what are the difficulties with that?
So for me, it doesn't really hit me as much only because I don't practice mixed animal medicine. So
Okay.
mixed animal practitioners, they're the ones they'll do the cats and the dogs, but they'll also do the exotics, so the snakes and the birds and hamsters and things like that. So they're like, I'm doing it all. I'm more focused on small or cats and dogs. However, in the ER, especially depending on the hospital where I'm in, where they'll kind of see everything, I'm kind of like, oh, so I'm seeing a rabbit right now. Okay, okay. Let me go brush up real quick. And I have to do that. Sometimes I'll get phone calls about snakes and everything, and I do have the option to say I don't treat snakes because I don't want to go beyond the scope of what I'm comfortable with, and then that's never good, right? That's almost like an orthopedic surgeon saying, "Oh yeah, I can perform surgery on your hand," when actually I need a subspecialist, right? I need a surgeon who is well versed in the anatomy of a hand for great success. I'm not saying the orthopedic surgeon couldn't do it, but
Right.
for great success, I need someone who's well trained in that area. So certain things I'll be like, no, that's way beyond my scope. Other things I'm like, okay, I can do it. So when it comes to switching my brain from like the anatomy of a cat, a dog, certain disease processes to now that of a rabbit, I really have to be careful because they're so different. They're delicate. Not only is the anatomy different, but disease processes, medications prescribed, all those things, the nuances can be a difference between life and death. So
Right. So yeah, that's. I was going to ask you this too. I'm glad that you brought that up because I noticed that my vet a lot of times they have a library. Uh,
hmm
well, not a lot of times, but I go to a big vet, and they reproductive specialists. There's maybe 6 or 7 different vets in there, and what they would do is they would go to the books,
hmm
and they'll go and research and look up different things just to be sure, or they might have a consensus. How often does that happen with the vet in your practice or in
it
your?
ha- yeah, it happens a lot. So there are some things where it's kind of like pretty status quo. You know what I mean? You maybe don't need to touch base with the books. You're like, all right, I've seen these cases a million times, not a problem. But you oftentimes will come across that one case where it's like you're not reading the textbook. So now it's up to us to go back now and just say, what am I missing here? You know what I mean?
Mhm.
Or consult with someone else. And that's, you want that because you don't want to be overly confident as a clinician.
Right, right. That's I figured that was something that because I noticed you get different diagnoses depending
hmm
on where you go. Some people may have a different theory. A lot of times it's based off of what information that the client is providing. Right.
Exactly. We rely heavily on clinical history. So I know a lot of people sometimes will get frustrated, and I do sometimes in the human world where the medical assistant will come in, ask you for my history, and then the doctor's like, okay, tell me your history again. But I understand now. I understand because when the first line of defense comes and gathers information, they bring it back to the doctor who's going to see you. They relay the information. The doctor starts thinking now, right? The wheels start turning, and then they go talk to you again to fill in all the gaps, make sure they have everything down to the T, because that can make or break the next step. And the last thing we do is mess up. So
Yeah, it's very, very important that you are making close observations. You can detect what time that you notice changes
exactly.
and differences in the stool, differences in the breathing, the eye color. What are
Ev-
some things that a person should, a checklist that a person can go over before, we call the vet and waste the vet time, or should this is
right.
something? What is it? Can you give us a breakdown on that?
I would say, okay, on an emergency basis, breathing is one of them. So if you're noticing that your pet is like experiencing labored breathing or like a faster respiratory rate. So in other words, especially when they're relaxed, you'll just see them, chest rise and fall steadily, right? But if you're noticing that it's like this constantly, especially when they're at rest, that's the red flag, and that's worth getting checked out. If when they're breathing, if they're using their abdominal muscles, so like if you're noticing that their belly is now a part of this whole breathing process, and that's something that needs to be checked out, especially when you didn't just run them. You know what I mean? They're just relaxed, hanging out next to you. That's definitely concerning. I would say as far as their eating. So every now and then they may not want to eat, just like us. We might skip a meal every now and then. I wouldn't really, care too much about that. But if it's like a whole day we're not eating, and on top of that, we're also not really acting ourselves. And now we're going into day two. You're still not eating. Maybe you might eat a little treat. Maybe you won't. Not even your favorite treat. That's a red flag. Again, coupled with, lethargy, where they're super duper quiet. They're just like, moping around, vomiting. When it comes to vomiting, and see, I can go off like on different tangents because not every time is it black or white, but a little
Right,
vomit here and there, I may not look into it too much because number one, I know dogs eat things they shouldn't.
right.
If we're human, that's different. I know I'm going to see somebody vomiting. If I see somebody vomiting and I know they just drank, I know you're vomiting because you're drunk, right? But if you're just hanging out with me all of a sudden, you're like, oh, guys, I got to get up and vomit. What's wrong with you? Okay. But with dogs, if it's like one or two times, again, we're not out there just eating things off the floor that we shouldn't, but they are. So they will be getting into things that'll cause you a little upset stomach. If you change their food too quickly, it's going to cause them to get a little upset stomach. So one or two vomits, that's fine. But if it's like constant, we're talking 3, 4, 5 episodes throughout the day, 6, and you're starting to get a little picky with food. Those are things you should look out for.
Right, right,
Versus like in
definitely.
general, yeah, versus like in a general practice setting, if it's like, oh, I'm noticing that the hair is getting a little thin, especially in this one area, I'm not going to run to the emergency room for that,
Right, that's
right?
something that we can schedule an appointment. It's a difference. It's just it's something
Big
that you
difference.
want. You gotta be able to say, analyze and break it down. I had a situation over the weekend where we had a dog we brought in from Chicago. He traveled on the back of the truck. He was intensely barking the whole entire trip. It's a 10-hour trip from Chicago to Cleveland. And when he get here, we ran him around the block several times. Then we separated him. He came with 3 dogs. He left by himself. 2 dogs stayed with me. He went with his owner.
Hmm.
And at the end of the day, he came back the next day. He was pooping liquid,
Hmm.
blood. There's some gastrointestinal, but he was still drinking water.
Hmm.
He was slightly interested in food.
Hmm.
It was a Sunday. Is this a situation where you will run to the emergency clinic? Yes or no?
I would say no. I would say monitor. Why? Because I know that this dog just experienced a very stressful event, the traveling and all that, right? So not and the thing is, not everyone's gonna know that stress diarrhea or stress colitis is a thing. Okay, so I too am learning, like, I can't fault people for what they don't know. But
Right.
anyways, so I hear that there's a patient that just experienced this extensive travel and new environment, blah blah blah, and he's stressed out. If he's still drinking water and if he's at least still showing some interest in food and the diarrhea now that's turning bloody, I would still monitor. I would still wait and see. If we're talking Monday and it's not improving and he's now like totally not eating, if I can't get in with my vet, I'm gonna call them on Monday. If I can't get in with them until like Wednesday, I'll be like, all right, I'll wait. Just keep the appointment. We'll continue to monitor and see. Maybe ask him, what can I do to support him in the meantime? Or I'll
Right.
ask, what are some things I should look out for that will prompt me to want to not wait until Wednesday and just go straight to the ER? And those things would be, now we're talking straight blood out the butt. Okay.
Right.
Super liquidy because they can get really dehydrated. Now we're talking, he's just laying there, not showing interest in anything. That would make me super concerned.
Yeah, and it's a judgment call. We all want the best for our dogs. At the same time, we don't want them suffering, and we don't
Right.
want them, just be running back and forth to the vet at every situation.
Right.
So, what are some things that we can do to support our pets when in times of discomfort? I often am an advocate for take the food away, give the
Mm-hmm.
dog give the dog's immune, digestive system a
Right.
chance to relax. Because think
Mm-hmm.
about when we're sick, we don't want to eat, and
Exactly.
right, so that's actually giving our body a chance to recover. I'm a heavy
Right.
advocate for fasting. That's one of the first. Anytime, if I have a loose stool, if I
Mm-hmm.
have a dog that is experiencing any type of gastro digestive, first thing takes to take the food away, and let's break it down to something very simple. What are
Right.
some other things that we can do to support our pets when they become discomfort without having to emergency? Like, do you do Pedialyte, chicken and rice? What are your tricks?
So I'm going to preface this by saying you're going to hear me sometimes never give you a straight answer
All right.
because there's so many nuances. First of all, we can talk, we can express ourselves. We know what we ate leading up to our episodes of diarrhea or vomiting and how much we drink. So we as humans, we know, okay, this isn't right. I know I didn't drink. I know I didn't eat anything different or strange. In fact, I didn't eat anything yesterday. Why am I sick? I should probably get it checked out like now. Okay. Dogs are different. And even still, sometimes when we feel like we have them in a very controlled environment, there's still something that's going to go wrong. And they can't really talk to us. So it's up to us now, like you said, to make that judgment call. Is this something that can wait where I can support at home, or should I get it checked out sooner? The other thing, before I answer your question, is that when things like GI signs like vomiting and diarrhea, or maybe like a little bit of what we call anorexia or hyporexia, meaning hypo, meaning like they're not really eating as much, but they're still like nibbling, is that they're so vague as clinical signs. Like they literally can fit the script for just about any disease process, something benign or something even more serious. So sometimes, like one was like, "Oh yeah, just try to support at home and wait it out." It's like, what? Am I doing more harm than good? Like, you know what I mean? Sometimes you just don't even know.
Right.
Now, keep that in mind. So to answer your question, I will just use my dog. So the Boerboel, his name is Mandela, and the Corso, his name is Aziel. They, by nature, I swear it's like a large breed thing sometimes, they just have sensitive stomachs. Okay. Now you imagine about 300 pounds worth of dog with vomiting and diarrhea. I can't. So anytime they break out with the slight, like once I see their stool consistency starting to change, we're going from soft, cow patty to like diarrhea. I'm like, mm-mm. So I pull the food sometimes like for the whole day. Sometimes they won't even eat for a full, like going on 24 hours, but I'll make sure I provide them with water. Okay.
Right.
And monitor their stools during that time. Another thing that I'll do, so let's just say I didn't give them breakfast, maybe not dinner, but I'll give them like a late night something another. I will
Mhm.
add psyllium husk powder to their food.
Fiber.
Yes. Yep. And it's great. So for them, I mean, I kind of eyeball what I give them, but they could easily get like 2 tablespoons mixed in with their food. And
I've
so
never
sorry.
I never tried that before.
Yeah, it's really good. So I'll start there, like twice a day, and I'll give it like a day or two. Give it some time to work, a day or two. But if things are still now just drip, drip, dripping, and I'm not seeing any changes, then I'll have to up the ante. As far as vomiting is concerned, I will again, like you said, pull their food and monitor. Sometimes they will still continue to vomit. It's either because, wow, now my stomach's super empty and you'll see like a lot of yellow bile coming out, or
Right.
is it a sign that something else is going on that warrants immediate attention?
Yeah. Yeah. I always make note. I want to express to people observation.
Mm-hmm.
Get familiar with your dog normal habits. You should know what's 100%. The
Absolutely.
dog starts dropping down. Like you said, laying around. I really am big on the eyes, and like I'm reading my dog, his whole facial expression, because a lot of times you can see. So if he's drooling, if his eyes look sad, you know immediately
Right.
this is a situation that I can't handle on my own. It needs
Mm-hmm.
to be addressed. Like you said, if I can get the dog to get up and get alert, I'm kind of like not concerned if he's interested in different dogs or
Right.
interested in cars coming and going and so on and so forth.
Playing
Okay,
around with you, things like that. Yeah.
yeah, it's sometimes they're not gonna feel 100%. So okay, he's just not feeling good. But that's a difference. There is a difference between the emergency situation and
Absolutely.
not feeling good. But that's good information. How important is developing a relationship with your vet, and why?
Super, super important. It is no different from us as humans with our primary care provider, whether it's an APRN, PA, physician, you know what I mean?
Mhm.
It is critical because preventative medicine, I mean, number one, if we're talking finances, it's going to save you a ton, right? It's going to save you a lot of money because if there's a lot of screening done, they catch things early, they can educate you, you use the time to ask them all the questions that you need, so that way when you see something happening you're not like freaking out, oh, I need to go to the ER and spend up all this money only to find out I could have waited. You get what I'm saying? So you really get a chance to learn a lot during those visits. Again, just stay ahead of the curve. Yes, they're still going to get sick, but what if I didn't have my dog vetted regularly? What would their health be like compared to the alternative?
Right, right. And you were just at the vet last week, so to speak, or whenever, and you got a history, you got an idea. You can rest assured. I know that I can call my vet, especially like you said, post pandemic. So many things have changed.
Oh
It
yeah,
could be months if you have to make an appointment. So
absolutely.
having that relationship with your vet, you want to be able to call. Um, I even source out several different vets.
Mm,
I got my spay or neuter vets. That's where I take my puppies. Um,
yeah.
I go there because even though they're not breeder friendly, they absolutely love the dogs,
Hmm.
and they're putting the dog first. So,
Right.
I'm there for the care for my dog. It's not about me.
Hmm.
So, and I'm talking about they fine tooth comb the dog. I know when I send a puppy from there that it's been extreme is vetted. I mean, they checking the heart, they check
Everything.
everything.
Hmm.
I really appreciate that, even though that they are spay or neuter advocates. So,
Right.
what's your position on the breeding for reproductive, so on and so forth?
I say as long as you are responsible, then do your thing. Okay. As long as you're responsible. We've seen a lot of irresponsible breeders, and that's what drives us up the ante. The mismatching with the male and the female, the puppy sizes being off, they can't pass the puppies, then it's emergency C-section, but then, oh, I'm not spending up all this money. He's like, well, it's do or die.
Yeah,
And then if and then depending on the situation, we'll probably a spay during the time of the emergency C-section. That's a whole nother issue. So it can get really bad, but like I said, as long as we see responsible, you're following our recommendations, our guidelines. And sometimes, you know, you won't listen to us because you're going to say, well, I find that what I've been doing has been working. That happens a lot. So I feel like there has to be room for compromise as long as the pet's health is in mind. So
right.
I recommendation might be, and again, you might be like, I think I'm just going to continue doing this. So we just kind of have to respect each other. And at the same time, I know that as your provider, I'm making the recommendation. I know it in the record, and that's all I can do. Because I'm not going to follow you home and say, "Are you doing this?" And that's not how it works. So why fight a losing battle whenever at the end of the day you're doing what you think is best. You're seeking care. You're coming. We're talking. We're having conversation. You take some things from me, and I might even learn a thing or two from you. And then that's that. Do we always listen to our physicians all the time when they make recommendations? No, not at all. So
Right.
it's no
With
different.
you in the first
And
place.
huh?
Yeah, I said we wouldn't be there at the doctor's office in the first place if we followed
Exactly.
everything to the T.
Exactly.
Yeah.
So
So now you got a Corso and you got a Boerboel. This I've been waiting on it, but I can't hold it back no longer because I mean you got a very unique perspective. Not only are you an animal enthusiast, but you also are female. You know, you're a mother. So you got dogs, you got these big dogs, you know, and I just want to know what was it like to raise two puppies at the same time.
mm.
Tell us all
Well,
about that.
so let me tell you, let me just give you a little back history. So years ago, before I had my first child, I had a Great Dane Mastiff mix whose name was Baloo. Okay, we couldn't keep him long because of just circumstances. So unfortunately, I had to give him up for adoption. He was around 2 at the time. I was devastated. I was heartbroken. It wasn't something that I wanted to do, but at the time, it was like, I guess, the best choice. So I never got over it. I've always said, I want another large breed dog. Like, there's just some things you just cannot let go.
Right.
So
Yep.
that was. So after Baloo, I ended up getting a Yorkie who I actually, unfortunately, just had to put to sleep back in April. So she was 14 years old. Then
Oh,
again,
I'm sorry.
it's okay. And around the time that I reached out to you, that was 2 years ago. That was, I think, like January 2022. Now, what was I thinking at the time? I don't know, but I just felt like I was ready to just be an owner of a large breed again. And it wasn't just one, obviously it was two. So I remember when I was talking to you and I couldn't decide on what I wanted. At the time I was following you and I was following a Corso breeder in Vegas. All
Okay.
right. So I think I spoke to you about your experience with Corsos, and I remember you shared with me that Corso that you had. Remember that story?
Oh yeah. Oh yeah.
Yeah.
I talk about that Corso all the time.
Yes. So the differences between the two, and again, I was just going back and forth. People were telling me you are crazy. What are you doing? And for some reason, when people tell me that, I'm like, even more reason for me to get it.
Right. Yep. I'm the
And
same
time
way.
you tell me no.
Like you say, I'm crazy. Oh, that must be a good idea.
Exactly. It's like because you can't do it, just doesn't mean I can't.
Exactly. Exactly.
So I don't know. I mean, I fell in love with both of them. What they're about, the physical features, there's just everything. And at the time, I had two older kids, so now I have a new toddler. She's 1. She just turned 1 a couple days ago, and now I'm
Congratulations.
pregnant with my fourth.
Go ahead. Oh, that's what's up.
So when I got those two puppies, obviously it was just my two older kids. So I'm like, all right, we can do this, right? And I had it all planned out. So I ended up getting a trainer because I knew that I would not be doing them any justice by raising them myself, like in the early years, right? I need help, and I will never not say, oh, I don't need help. So I had that secured. I got them. I think I got Aziel first, the Corso, before the Boerboel came.
Right.
And I don't know. I just had fun with it. I respected their breeds. I did more research. With the trainer, I made sure it was someone who's familiar with the breeds. And I respected the way he trained, because not every trainer is the same. So
Right.
and we just did the thing. And once let me see, once I found out I was pregnant with my third, I was like, oh, all right then. Well, how am I gonna navigate this? How's it gonna work? But I didn't really think too much about it. I just said people have done it all the time. Like, I'm just gonna do it. The good thing was that by the time I found out I was pregnant with her, they were about it like a year or so. And so they had gone through a full solid year of training with the same trainer.
Did the dogs make a difference? Did you know any difference in the dog's behavior once they found out you were pregnant?
No, I didn't see that unless I wasn't sensitive to it. And what
Okay.
I did do to prep them for her arrival was play a lot of newborn cries
Okay.
before she came to get them desensitized to that noise. I let them, when she was, when we finally brought her home, I would let them sniff some of her clothing so they'd start, becoming familiar with that stuff. And so I kept the distance for many months. So they're created in the home. I'd like bring her up to them sometimes, sniff, sniff, and that's it. Now that she's older, she's like starting to walk now, so she'll want to walk up to the cages. I'm there. She mainly stays by the Boerboel, and he just sits there and he watches her. And sometimes she'll try to poke her finger through, which got to be careful. But I'm there, I monitor, and he'll sniff and he'll just like, that's it. And then I pull her away. I'm creating
Mm,
boundaries. When they're out together, obviously I'm always there. I let them sit around her, whether she's standing, eye level to them, or I'm holding her. And there's no room for any foolishness. So if they're gonna go sniff her, I say, all right, come on, I'll let them do it. And then I'm like, all right, enough, off.
right, right, right.
That element of control that you have to have.
Very good point. You have to monitor. You're not going to allow the dog to roll and play with an infant and then the dog to be a supervisor.
Mm-mm.
You're going to monitor those interactions.
Mm-hmm.
You're going to let the dog know how gentle, how careful, how delicate that the baby is.
Right.
And it's almost like, this is how you transferring this understanding to the dog. Mm-hmm. And the dog picks up on the change in the energy.
Yes.
The way that we're moving, the carefulness, all of these things, the dog makes a sum total decision. And I think that they eventually learn that the baby is very, delicate. My dogs, I got a 1-year-old also.
Nice.
Yeah, and it's the cutest thing. It's the cute, she's fascinated by the dogs. But they're very gentle, they're very careful, and it's like instinctual. It's hard to explain. What do you think that is?
I think it boils down to like pack instincts, right? So first of all, I already, long before she was born, they already know that they're down here.
Right.
And that's just how it has to be, right? So we're up here, they're down here. They respect that, I respect them, but you're still down here. With her, she's a new member of the pack, and just like with a puppy, they're not, unless they're not right up here, just like aggressive, whatever, they're not going to roughhouse puppies. They know puppies, the difference between a puppy and an adult dog. The same way they know the difference between a tiny human and a big human. You understand?
Right.
So, but then there's also, like you said, fostering that the delicacy with their movements and how they approach that child, that we have to foster. We have to foster that, because otherwise they're going to look at her or him as a toy, especially if they're prey driven. So it all boils down to, like you said, knowing your dog. And yes, breeds collectively are the same, but they're still individual personalities that you have to be aware of.
Right. And you need to be in tune. You need to be in tune. Just as much as the dog is observing you, you have to be observing the dog.
Absolutely.
And in my experience, I kind of sum it up as, because the dog is always calculating and measuring and making these observations, they're able to note the difference in the strength of the baby's voice, the rhythm in their movement, the steps, the sound, the power, the impact when the baby touches the ground.
Right.
They're putting all of these values together. They make a sum total decision that this is this is a baby. It's a baby. And I need to be very careful, because I'm watching the way that everybody's moving around the baby, the voice tones and everything like that. And I think that the dogs, especially when you're talking about Corsos and Boerboels, guardian protection oriented breeds, I feel like they're more similar than they are different. What do you say?
I 1,000% agree. Oh my God.
Yeah.
Whew. Yeah.
I mean, they always want to act like, one dog is better than the other, and the other dog is better than the other. And I have both. And the first dog that I had as a grown man was a Corso.
Right.
So, and I'm very partial. I'm like bond. I kick it and vibe with my dogs. We have an intimate relationship. This dog, like, we had situations where it was people attempting to do thefts. Like, this dog saved me. She bit 13 people. We had an intimate relationship. She was a great dog.
Yeah, she was.
She was a super dog.
Yeah.
Now I got Boerboels though, and I get this question all the time: which one would I choose to leave with my babies? Which one would I choose? And I just like, it's like trying to pick over, choose one of your children over the other. You know what I'm
For
saying?
me, I will say, if you were to ask me that, I would say I would, if I had to pick one who I would leave even for like 5 seconds alone, I would choose a Boerboel.
Why? Why you say that though?
Because, and again, this boils down to, is it just you and your personality, or is it just a breed thing? Like one of the nuances. He so far he has turned into such a, how can I say it? Like just a whatever goes, goes, man. You know what I mean? Sort of dog. They're so nonchalant. Like he can turn it on, don't get me wrong. But
Right.
he knows when to turn it off. He can be just so gentle and just so passive, but not in a bad way. He'll just lay there and calm demeanor. Aziel, on the other hand, the Corso, he's still going through his goofy phase. He doesn't realize his strength sometimes. And I wouldn't say like he would go hurt her, but just more the sheer size of, oh, hey, and then claws come down, that sort of thing. So he's still, that self-regulation isn't 100% there yet with him. But Mandela, he's just more like,
Laid
hey,
back. So
very
the
laid
big,
back.
what would you say the biggest differences between the two?
I would say, aside from that, what I just mentioned, Mandela the Boerboel, he is definitely more independent of the two. And that can
Okay.
come off as like stubborn, right? Whereas Aziel, he's more responsive. He's quicker to please. You understand?
Right.
Um,
Right.
than than Mandela is, and I don't necessarily think it's a bad thing for Mandela. That's just him. That's just how he is. So, for example, when we're going out to walk, I do use a training collar with them. And right now, Aziel has destroyed one of them. So I only have it for Mandela because he's more of the, I'm going over here. I'll see you guys in a bit. So I'll have, I'll put it on him, and sometimes I don't even use a leash for the Corso. My neighborhood
Mm.
it allows that because I don't have a lot of traffic. But if I do use a leash, it'll just be for him, and I'll let Mandela do his thing. He'll be going off. He'll be trotting off, not too far. And if he does, I'll call him right back, and he'll turn around. And he'll wait. But he's off like, I'm just sniffing. He's not like sprinting or anything. He's just like, I'm just doing my thing. I know where you guys are. You know where I am. But Aziel, when I have him with no leash on or whatever, he's not out there wandering off. He's right by my side.
Mm. So it
You know what
has.
I'm saying?
So
And so it's
you recommend the Boerboel because he's laid more relaxed, or why? Why did you? One more time. You said the Boerboel. You said that
so
the
yeah.
Corso.
So for as far as who I would have around my 1-year-old for at least 5 seconds, if I had to turn my back, it would be Mandela the Boerboel.
Okay.
Because he's more laid back around her, and kind of in general, whenever Aziel the Corso, he gets into this goofy stage, his self-regulation isn't quite there. And so with the paws throwing down, and you know what I mean.
Right. He
it,
jumped. He had a little bit more energy.
Yeah, just to get, sometimes you get a little bit much. And again, he's not trying to be mean or aggressive. It's just, hey, I'm just a big goofy guy. That's him.
Right. Right.
Right. When we're out walking, when we're out playing, I have observed that Mandela is more independent minded and can come off a little bit stubborn. Kind of wants to do his own thing. Whereas the Corso is kind of like, yes, human, you call me? All right, I'm right there. I'll be right there. Mandela can be like, anyways, as I was sniffing, you know what I mean? So, yeah.
Like, you all right. You all right. You don't need my help. You don't
Yeah,
need my help.
exactly. Do
You
you
good.
really need me? So, yeah,
And that
they're
Corso
funny.
right there earning, trying to work.
He's
That
right,
Corso right there.
exactly.
Yeah. I sum it up as an intensity and an energy. The Boerboel is like milder because he's the bigger. Well, not necessarily the bigger, but they tend to be like have a big man type of attitude.
Mm-hmm.
And whereas that Corso, he got something to prove. He kind of got a chip on his shoulder. He's running to work. He wants to get out there and show what he can do.
Yes.
He's willing to go across the street if I need you to go across the street. Yeah, he ready. He ready.
So well said.
Yeah, so it's hard for me to choose because I'm just a dog lover. As a dog
Right.
lover, and that first dog, I mean, she slept right next to my baby's crib.
Mm,
And she was no, I mean, she was a legend. You
yeah.
know, like I had some of the realest, some big time people come through that's like scared of nothing. And then they're like, man, that dog, man, get the dog. Well, she was a
But
heck of a
see,
dog.
they complement each other, right? The both breeds really complement each other well. And I I always say if I had to pick one, I don't know who I would pick. Now that I've experienced both at the same time, I feel like I would always double up again.
Yeah. Now, I was just telling someone yesterday, I said, you probably gonna need two dogs.
Mm-hmm.
Need to, because you want a dog that's strong and fast and can run. And it's gonna be a little bit different than the dog that's there to, that's big and powerful and everything
Right.
like that.
Mm-hmm.
So I wanted to ask you about the skin issues.
Mm.
I mean, this is something that we see so often. I mean, all the different breeds, the allergies.
Mm.
How real is dogs being allergic to grass, dogs being allergic to air, dogs being allergic to dirt, dogs being allergic to bark? You know what I'm saying? It seems like they're allergic to everything. is that
It's
is that a real thing though?
it's very real. And I feel like it's either that it's being overdiagnosed now, or it just so happens that the prevalence or the incidence of cases are just increasing. Overdose meaning like, or overdiagnosed meaning, is this truly an allergy case, or are you just saying that it's diagnosing it as such? You know what I mean? Are
Yeah,
we more sensitive to it now because we know more about it? There's more testing, so there's a lot to consider. So I wouldn't say that it's overdiagnosed as far as like falsely diagnosed. I think we just know more about it. We know what it looks like. And yes, what is going on in our environment to have these things happen. Because I feel like now, yes, there are certain breeds that are genetically predisposed to like just awful skin, like pit bulls. Oh my gosh, especially the blue ones and the white ones. It just comes with the territory.
right.
But I just feel like in general, more and more breeds are just coming up with allergy, allergy, allergy. And it's just blowing my mind because we're now even seeing some of these cases in the ER.
Mm,
And usually it's because they're just so uncontrollably itchy. And I know it must be hard as a pet owner to watch your dog just constantly scratching with no relief. And sometimes they'll itch themselves to like this, to the point where the skin's red, might start bleeding. You got these weird lesions, so it's real. Short answer, it's very real.
so my next question would be, you alluded to some of it being caused by environmental. The other
Hmm.
cause would be genetic. How much influence is that related to inbreeding depression? Because of dogs they're not as purposeful, function oriented as they were once. That in the back in the day, back in the day, my granddaddy would always tell me he never took his dog to the vet, and he
Yeah.
thinks that crazy, that I'm buying expensive dog food and stuff like that. Are we weakening in our dogs? Are we causing them to become softer because of the way that we're selecting and breeding, or is it
Mm.
because the environment is changing so rapidly? The things that we're including, the chemicals in the dog in the foods,
Right.
the mass, the industrialization of the food industry, you know.
Production. Yeah.
So, what was your take on that though?
That's a good question. So, my background is Jamaican, all right? And I bring that up because when I think back to my childhood out there, granted, there's certain things I didn't know at the time, but I'm like, I don't really remember people talking about allergies in dogs out there. I went to vet school. I spent majority of my years in vet school in Grenada. Same thing. It wasn't really a thing. Now, is it that it wasn't really a thing because it just wasn't being diagnosed?
Mm,
Okay. Or was it just not really a thing because of the environmental factors at play? So, yes, they have kibble out there, but a lot of times people are feeding them, their table food. You know what I mean?
right.
Or for the dogs that aren't owned, they're out there roaming the streets, eating whatever they can from the garbage. So, I can't say for sure what it is. Now, as far as breeding and the way we do things in the US, yeah, we could be contributing to it, because part of the whole allergy cascade has to do with the immune system and like the epidermal barrier of the skin, so like that outer layer. And if it's compromised, if the integrity is weak, which could be a genetic thing, right? Then it's like it doesn't matter what you do, it doesn't matter what you feed sometimes or whatever, it's just going to happen.
Mm.
You know what I mean? So that's a loaded question, and I don't know if there's any one answer. It's
And
definitely multifactorial.
yeah, it's definitely multi-layered because in my experience with the Boerboel, I feel like um, a lot of what's happening with the dogs, people don't understand the genetic history and the makeup. I see a lot of demodectic mange as a
Mm.
result of a compromised immune system
Mm-hmm.
being misdiagnosed as allergies.
Right.
I know that the skin scrape test often is inconclusive, whereas you have to do several skin scrapings in order to find that mite.
Right.
Anytime that the immune system, becomes imbalanced, it gives the mite a chance to take advantage of the
Mm-hmm.
dog. So I feel like a lot of it is with the Boerboel in particular, skin issues is mange related
Mm.
to mange.
Mm-hmm.
But it's that's just my personal opinion. So I often treat for the mange. That's my first thing. Anytime I have a skin issue,
Right.
anytime I got skin issues, I'm going to treat with the ivermectin. It's
Mm-hmm.
simple solution, and it works. It works. It's
But
often
see,
more.
and that's how you can know. Sometimes empirical therapy is warranted. So if you're suspecting is Demodex and skin scrapes are always negative, then go ahead and treat it as though we're Demodex and see if there's a positive response to treatment. And if so, then you can say more than likely this was, these changes in the skin were a result of demodectic mange, as opposed to you're saying, all right, I'm not, skin scrape negative. I don't know. Let's just treat it as though we're allergies.
That's what
You
I
see what I'm
see
saying?
happening. Yeah, I see people getting dogs sent home with antibiotics. They may do a temporary solution, and then they send the dog home, and it's like, man, there's no change. It's not working.
Mm-hmm.
Over prescription of antibiotics is something that I'm always concerned about because what happens in my experience, the dog will build up a yeah, he's gonna build up what they call a tolerance.
Yeah, resistance to the
Yeah,
antibiotics. Yeah.
resistance. Yep, you said it. So, but and we have to be very careful. We have to be very mindful. I'm one to even with the anti-flea, anti-fly sprays. I'm only using as needed.
Mm-hmm.
I don't want to be like over chemicalizing my dogs. It's chemical. You think about it. You spray this stuff in the environment, and the flies leave immediately. That's
Mm-hmm.
telling you something right there. That's toxic,
Well,
right?
two things. Okay, going. So your antibiotic comment, I do agree with you. And we collectively, so not just in veterinary medicine, but in human medicine as well, we're
Yeah.
supposed to be, um, using them judiciously. We're supposed to be more cognizant of how we're using these drugs. So my whole thing is, in the perfect world, you want to do a proper workup, which are the diagnostics that we recommend where people think, oh, you just want my money. But we need to do the workup so we know what we're treating. So if there's
So
no,
that
sorry,
would be that would. I'm sorry, I didn't mean to interrupt you, but I
that's
wanted
okay.
to catch you on that point. You said the proper diagnostics. That will be blood tests.
Well, for skin, if it's like super skin related, okay. So for example, if you came to me, whether I'm working a GP shift or an ER, and you're like, oh, noticing like a circle of missing hair, and he's constantly itching, and seems like the circle's growing, or maybe I'm seeing more here and there. I don't know what to do. So I'm going to recommend, depending on, I look at the whole picture. So like how old the dog is, if there's any other abnormalities that you're noticing, blah blah blah. But if it's just say a fairly young dog, like 2, and that's your only concern, I'm going to say let's just do some skin tests then and see what's going on.
Mhm.
Because if I find that there's evidence of a bacterial infection, then I'm going to use antibiotics, right?
Right,
But if
right,
I do the test and I'm like, I'm not seeing any bacteria present, maybe I'm seeing yeast. Antibiotics aren't going to clear yeast.
right.
So I know exactly what drugs to reach for. Or maybe I'm like, okay, I'm really not seeing anything at all. Let's consider, this, let's consider that. Or sometimes I'll say just monitor, and let's just see how this will respond to benign neglect. Is it getting worse? Can you start taking pictures of the document? At some point, do we need to consider a skin biopsy or something like that, right? Or maybe we retest in a couple of days because sometimes we miss things. If it's a situation where a person is strapped for cash, because that happens, and it may not look bacterial in nature, like some lesions do look like, okay, even if the underlying cause isn't bacterial in nature, you definitely have a secondary bacterial infection. Here's some antibiotics. So you'll clear up that secondary infection, but you still haven't addressed the underlying cause. And sometimes that does take some time and work up. But whatever. So let's just say a person comes in, they can't really afford much, and is like, I just need some relief. Da, da, da. Sometimes we will reach for the antibiotics. Sometimes. Why? Because we know, all right, more than likely you're itching, you're damaging, your outer layer. You're going to introduce bacteria. That'll probably help. But we tell them this is an empirical treatment, meaning I'm not diagnosing anything bacterial in nature. You're strapped for cash. You can't afford the diagnostics. You're tying my hands, so I'm going to try to work with you. So
Right.
that happens sometimes.
Yeah, sometimes. So how dangerous can that be, or how? Because I know a situation had occurred one time where a person was giving the dog a certain antibiotic, and it was actually feeding the um it was some kind of, it was a fungal infection, or it was a secondary skin infection, and the antibiotic was feeding. Is that a reality?
No, I wouldn't say is feeding. I think if it was fungal in nature, that just means that the antibiotic it was useless.
Okay, so
Or
that's what it was. It
the
wasn't
fungal
working.
infection was just growing. Yeah.
Okay,
So
okay,
that
that's what it
if usually if it's a case like that, then for me, I would say, and I know a lot of the doctors do too, will say, listen, if you're not seeing a positive response, you heard me say that before, a positive response to therapy in, like, let's just say a week, that
was.
means that something, like, we need to address this again. If it seems like it's getting worse in like a week's time, give a couple days, so up to a week, this needs to be readdressed. So we try not to just say, here are the drugs, bye, good luck. We always say, listen, there's a chance, there's a chance that it's something negative is going to happen, but the sooner you bring them back in, we can reevaluate to say, okay, clearly the antibiotics aren't working because either A, it's not bacterial in nature, or B, whatever bacteria, if you truly have a bacterial infection, whatever bacteria are growing are not susceptible to what we've prescribed. So now culture comes in handy. This is, is more diagnostic. So what exactly is the skin growing, and what antibiotic is needed? You have like, um, resistant bacteria that are growing that can be harmful to people who are immunocompromised, whether it's like, especially MRSA. Dogs will grow
Right.
MRSA.
I was just gonna say MRSA.
Yeah. So, but they also have their own like MERS P, which doesn't affect humans, but at the same time, you just don't know what you're dealing with. So if you're sitting here pumping up dog with different drugs, you don't know what bacteria you're working with. It's just a recipe for disaster.
Yeah. So diagnosis, everyone. You want to make sure that you're getting a very good analysis. Don't just jump out there. I mean, put some money to the side for emergency situations for your dog. What are your thoughts and feelings on pet insurance?
So for me, I mean, I will always encourage someone to get it. Side note, I don't have it for my dogs. I probably should. I always said I was gonna, but I just never bothered to. But I see where it is very beneficial. And for me, it's definitely in the emergency setting. You think people wake up and they think to themselves, "Oh, looks like I'll be dropping $6,000 to $8,000 today on my dog." No, no. You know what I mean? At least for the general practice visits, it's planned ahead of time. You have the physical coming up in June, so you start saving towards that, right? And
Right.
still
Right.
aside for the just in cases. But for the ER side, you don't know what your dog's out there eating and whatever, and it turns out it's a foreign body, and it's like, if we don't surgically intervene, your dog's gonna die.
Mm. That's one of the saddest things that I've ever had to deal with. The
Yeah.
exploratory surgery, trying to do a diagnostic, the dog's suffering, and you
Hmm.
got to make a decision. Do I go to the bank and I got to go get $4,000 right now today?
You're lucky if it's even 4,000.
Right, four
I've seen
thousand.
estimates like up to 10,000. And yes, it's case dependent. and situation but dependent, but these things can get very, very costly. And I don't just mean like foreign body stuff. I mean anything. You have some immune mediated disease that just pops up out of nowhere, like it can get really bad,
Yeah.
really bad.
Is there anything the common pet owner should do? I mean, because I had a situation where I had a client got a dog for me. He was out in the field or whatever, he cutting trees or doing something. The dog then had an allergic reaction. He takes the dog to the vet. It spent 7 days in the ER, $12,000.
So couple things. Sometimes allergic reactions just aren't allergic reactions. It could be like a case of anaphylaxis. Anaphylaxis will kill your dog straight up.
Yeah. Oh wow.
So
What is that?
so basically, so you have your allergic reaction, which is typically, you know, a matter of like hives, some facial swelling, which it's not benign because it can always worsen, just like with a person, right? If you have a peanut allergy and you start to get an itchy throat, don't take it lightly because the next thing you know, your airway's swollen and you're dead. Okay.
Right.
So it's kind of the same thing for dogs too. But then you can start, the immune system can start like going into overdrive and just go haywire. So you're going from a simple, what seems to be allergic reaction to now the dog's vomiting. So showing systemic signs of illness. Dog's vomiting. It's now collapsing. It's bleeding into its abdomen. It is probably having a seizure. You know what I'm saying? It's clotting factors that prevent us from hemorrhaging out are now, we say prolonged, meaning now they're at risk for bleeding out. All kinds of weird things. The blood pressure has tanked. Like they're literally on the verge of death. So those cases are very severe, and typically they're diagnosed, they're a diagnosis based on exclusion. So not all the time is it a slam dunk diagnosis when they walk through the door, right? So it takes time. And then what can keep a pet, just like with us humans, what can keep them in for longer than you would expect is how are they responding to the treatments that are being administered. So we can't help it if their body's not responding. You know what I mean? So we're doing everything that we can, but if they're still not responding well, how are we going to send home a half-dead dog?
Can't do it.
The other thing that can drive up the bill is the size of the pet. So medications, how we dose them for us, it's based on weight.
Right.
So if I have a pet that's in my ICU, they're not eating, they're obviously ill, that's why they're there. All medications, majority of them, have to be given intravenously or intramuscularly or whatever. So meaning no tablet by mouth, right? You're not eating, you can't get oral medications, or your gut's shut, it's not going to absorb well. Injectables add up. Sometimes these injectables are like twice a day, sometimes 3 times a day. And we're talking high volume if you have a 180-pound Boerboel compared to like a little Chihuahua. So we could be treating the same condition, but Mandela's bill is going to be way more than my Yorkie's bill.
Right. Right.
So that's the other thing to keep in mind.
Yeah, it was a really sad situation. It was a sad situation because I wanted to be like, bro, how can I? He was saying, man, you sold me this dog. He had it 2 years. He said, man, this dog done cost me $12,000, man. Yeah. And and I don't want to blame him. Like, bro, I ain't got nothing to do with what you fed. How let the dog wasn't. But it was just a tragic situation because I could just feel for him. And then I just thought about that to myself. I said, well, what could we do in the future to prevent?
Sometimes nothing. I mean, aside from getting help in dire situations, like when it happens, sometimes nothing, because things happen just like with us. When we go on the road, we know, like, we don't turn on the car going, driving down to the grocery store thinking today's the day I get hit. Today's the day, I'm going to the yard. No, we know that there's a chance, but is not here at the forefront of our mind. We just pray that another day, another accident-free day, I'm good. Another day, I didn't fall off the ladder, I'm a contractor. You know what I mean? Like, for me, another day I didn't get mauled by my patients. You know what I'm saying? So, but it happens. So you just have to be realistic. Like me, I think I probably take it for granted because I am their vet. But should I have health insurance? It would be a good idea. But I'm like, what? I'll just do with it when it comes.
Yeah, you got the secrets. You know what to do. You like at home, you know what I'm saying? And then you got the clinic. You already pull up, like, hey, y'all, I'm coming in a little early today.
Right.
So,
But
I really wanted to just give you your flowers, let you know how much we appreciate all the hard work that you do saving our pets and stuff, even though you haven't never worked on my dog, but I'm sure that it's, a lot of people appreciate what you're doing. I could tell from your spirit that you really are into and love what you do. And I know that could be stressful. I know that could be stressful, especially, with everything else that we got going on. And being a doctor, you're not able to save everyone,
right.
and that's got to be tough. So I just wanted to tell you, we appreciate you. But if you just expound on that a little bit, like the difference, the trials and tribulations, and how do you just keep yourself going as an emergency vet, when you lose a dog that, you were working so hard to save.
Yeah. So I'll say this. I remember my first 12-hour shift, I had 7 euthanasias. I had to put down 7
Mm,
animals. 12-hour
mm,
shift. So, and it will be like either I have back-to-back euthanasias or I have a euthanasia. I literally go from that room after having put their dog to sleep, tears, emotions, all of that. And then I have to go into the next exam room for something that probably should, whether or not it needed to be there, but just the fact that I have to switch emotionally, switch gears and go in from tears to, hi, I'm Dr. Armstrong, da 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 da. And hi, Dr. Armstrong. So it definitely wears on your on your mind, um, especially when you already have a crazy day. The emotional switch up. It sucks whenever you have a patient that codes, for instance. Okay, whether it's during something routine, like I work in conjunction with a boarded surgeon, and at any time, like we don't really work together as much because my schedule is different. But before, when we worked a lot, if he's downstairs doing surgery that could be like a routine thing, and all of a sudden he's having issues, he's calling me.
mm.
So I'm already dealing with my patients on the ER floor. Then I got to run down, you know what I mean, and like help them out or help out the nurse who's doing anesthesia, stuff like that. Um, it's just very taxing. Like we have patients who need not, like, sometimes like there's no reason for you to have coded. What happened? Sometimes we don't get answers. Or we'll have a patient, like, say for instance, cats. Male cats love to get blockages, bladder blockages, urethral blockages. We call them urinary obstructions, and that can be, that's definitely life threatening. So if we have like a young cat, 2, 4-year-old, even a 9-year-old cat I had the other day, it's not cheap to deal with these cases. I'm talking, all of a sudden you think your cat's just a little trouble, and I'm talking, so your estimate is $3,500 to $4,500.
Mm.
Not everyone has that on the ready to be like, here you go. And the alternative is, if we don't do it this way, we might as well just euthanize your cat, because he's literally going to die a very painful, horrible death.
Mm.
I'm talking about euthanizing 9-month-old cats, 2-year-old cat. You know what I'm saying? And it's hard. It's so hard. Or when I hear people say, "This is all I have left of my daughter who died a couple years ago. This animal is all I have left." Oh, I'm just like, all right, I'm done.
Yeah.
That's
And I try to really like support my vets that I go to. I want to let them know how much I appreciate them. I want to send them, like letters, letters to know this is how the dog turned out, or this is the puppies turned out. Um, because I mean, I want them to know, like, you really play a part in the success of this breeding or these dogs or this. And I appreciate that. I appreciate your effort. I appreciate, because I'm there a lot of times, and I see people bringing their dogs in. Sometimes they coming in on the stretchers, like you said, people walking out in tears and stuff.
yeah,
And I'm sitting on the outside watching them come out one at a time. But you on the backside, and you working with each individual.
at the same time, a lot of the times, yeah. And back to the tribulations that we face collectively, I would say outside of euthanasia, what can make things very difficult and challenging for us are the pet owners. You guys will literally drive us to the point of wanting to jump off a bridge. Is that, it's like, I will never forget. I had one of the shifts from hell. I was working an overnight shift, and one of the most stable patients there was a very old arthritic dog.
Mhm.
Okay.
Everybody else was.
Everyone else was it was like crash and burn, crash and burn. The owner of the old arthritic dog, who was just there for arthritis, like, what are we going to do at 2 in the morning on 14-year-old hips that you know are jacked up? That's like a 90-year-old man going to the ER saying, cure my arthritis, make me feel better right now. That's no. The arthritis was not a new diagnosis. You know what I'm saying? Nothing about this. But anyway, she complained. She got mad at me. She was disrespecting me. And there was another nurse out there. She was just like going on and on. And those things really, they really get to you. It's angering, it's very frustrating, but it's also, it just kind of tears away at your fibers because it's like
Yeah.
you feel like you're doing the best that you can, right? And then here you have this one person who's like, it's not good enough. Never mind. I know I see them crying and I'm sure, that one's dying, but I've been here for 3 hours. So why is
Oh
this a,
yeah.
yeah.
That's another thing. I
Mm-hmm.
hear people arguing with the vet. Hey, I've been in here. Nobody came to see me, and all of this. When I go, I'm just like so appreciative. I
Can
want
we
them to
clone you?
say it one more time.
Can we clone you?
I want them to know. I want them to know. Listen, because you're doing something for me. It's like you actually you're not and then necessarily doing it for me, but it's still like for my dog, and you don't have to see me because
Well, the thing is, I just wonder, like, do people think that we just cherry pick who we're going to see? It's always when you're going to the emergency room. First of all, there's no scheduled appointments. It's emergency for a reason. Versus when you go to your PCP, you have appointments unless you're going to a walk-in clinic. All right. And even if you do go to a walk-in clinic, they're always, first of all, it might be a first come, first serve, and they'll let you know, or they're going to say, if this case is sicker than what you're dealing with, you need to sit down and just hang tight. You understand? And we always deal with the critical patients first, but that's common sense.
right,
Why would I see your broken toenail over a dog that's having seizures back to back and is about to go brain dead? Make it
right,
make sense.
yeah, and this and folks. So that's why we just say, hey, listen, when you go to the vet, just keep your head cool.
Mm-hmm.
If it's anything that you can do to support your vet, I done bought pizzas for the whole staff. You know what I'm
We
saying?
like wine.
Right, right, okay. We know when we go to the modern vet, you go get some Carlo Rossi, some Mad Dog. We're gonna bring you Mad Dog.
Oh my gosh.
But yeah, Doctor. So listen, I don't want to take up very much of your time. I really appreciate the fact that I've been waiting on you to come, and I finally
Really?
got. Yes, because I want to know. You got to get some pictures of the dogs too.
Oh, absolutely.
Yeah, and I see you doing your thing. I want you to know that I'm here to back you up. If it's anything that I could do, if you got questions, well, I mean, I know you got all the answers and stuff. I probably got
I
more
don't have
questions.
all the answers. Come on, I don't. I watch videos and I still learn a lot. So just so you know.
Yeah, I got one last question because this was a good
Yeah.
one. How much of an issue are the breed experts, the breeders,
Mm.
that come in? Because I never want to be that person that's like arguing with the vet because the vet is a paid professional
Right.
and learning. How big of a issue is that?
So it can be very problematic whenever breeders are misguiding the pet owners.
Say it again. Okay, we had went down. We
Oh
had went.
yeah, we got glitch. Yeah.
Yeah. So yeah. I was saying though. I was saying how big of an issue is that when you go into the vet, the pet owner is trying to tell you how to treat the dog. How should we behave when we come into the vet? I'll keep in mind that you're here looking for services, you're looking for solutions, and the vet is there to support you. It's not somebody that's an adversary.
Right.
It's an ally.
Right. So breeders who come into the vet with preconceived notions, all these anecdotal information, all that stuff, and it's like they're coming in ready for war. Might as well just go somewhere else. The relationship's done. You get what I'm saying? Because it's
Right.
like, first of all, you've come to us. We didn't pull you. You come to us, and you came to us for our expertise, to answer questions or whatever. If there's something that you strongly believe in, then talk to us about it. Just be like, oh, so my thoughts on vaccines are XYZ because blah blah blah. We can have a civil conversation. Then the vet can counter with, well, according to research, here are a few studies if you want to take the time to read it. This is why I recommend it this way. I cannot force you to do it, to do what I recommend. I can only document our discussion, and I give you all the information so that way you can make an informed decision. Whatever you choose to do, you do. And if it's something that I know is going to impact the health, I'm here. Call me when they get sick.
Right. Yeah, go ahead and try it and hit me back. I'll be there. You need me if you're going down, you start going downhill, hit me back.
Exactly.
Yeah.
So that's just how I look at it.
Yeah, I respect it. I respect it because I've been there. Like I got a relationship with the vet because I'm a breeder, and I'm always making sure, like I got reproductive stuff that I'm going, progesterone,
Right.
vet, puppy inspection, shots, pre-breeding inspections, all of that stuff. So I want to talk with the vet, and I want to let them know that, listen, I'm going above and beyond for my dogs. I'm not one of these people that's just trying to like you working the dog like it's a commodity. Like I really care. And so then they take that extra effort, that extra interest. They come, they love our dogs. They love our dogs. So I always wanted to let board buddies, I want y'all to know that a relationship with your vet is just as good as important as a relationship with your banker or relationship with your mechanic.
Your lawyer.
Yeah, that's a good one. I ain't forgetting about that. Yeah. So and in closing out, I just want to say, treat people how you want to be treated. When you come into the vet, know that you're looking for service. That this person could have been through so much. They might have seen 50 clients before you, and they're doing all they can to put it on fresh for you. So just be a little sympathetic with your vet. Have some patience when you go in there, and it'll go a long way. Remember to treat people how you want to be treated, first and foremost, and that's going to apply universal, no matter what you do, whether it's business, whether it's play, personal. So that's my advice. And like, is it anything that you want to say before we close it out? Because I don't want to take. I really appreciate your time. I'm like,
no, I honestly feel like we could talk all day. This has been really good. It's a lot of fun.
Thank you.
Yeah.
You got anything?
Yeah, no, I would just say, as far as like the emergency side goes, just try to just think of it as something is bound to happen. Not to say you're speaking into existence, but realistically speaking, whether it's when they're 2 years old or 10 years old, something is going to happen that's going to require some emergency funds. So just keep something on the side, even if you're putting like $50 a month, in your collection for your dog or your cat. Just do that. It'll make a big difference. And try to research ahead of time the emergency hospitals that are around you. See which ones accept things like care credit, or you know what I mean, like different ways to help you pay to make it more manageable. Just prepare, just plan ahead. And again, once you keep that relationship with your primary veterinarian, you can talk about some things. I have a large breed dog. What are some things that I have to be mindful of? Generally speaking, like you said, are there some things I can do to prevent or decrease the chances of XYZ happening? What can I do? You know what I mean? And I think that you would be doing yourself and your dog a great justice if you follow the recommendations. And if you have any questions, if you feel like challenging them because your breeder said this or that, you can, but just be respectful and just have a conversation. That's all.
Yeah, it's an information exchange. Nobody is right or wrong. It's not a competition.
Right.
It's not a fight. It's not a contest.
Mm-hmm.
Yeah. Well, doctor, I'm gonna let you get on to your day. I appreciate you so much, and I'm looking forward to bringing you back if you got more time. I know that you got a lot going on. Young family,
Yeah.
1 year old. I know what that's all about. But wishing you the best of everything, much success, many blessings, and a whole lot of peace.
Thank you. Same to you.
All right, much love, much love. Dr. Armstrong, you want to let anybody know how to get in touch with you if they need you?
Yeah, so my website, I do have one, but have been super lazy, so don't even go to themodernvet.com, but I promise I'll get on that. But if you go to YouTube and just type in The Modern Vet, you'll find me. If you know of anyone who's remotely interested in veterinary medicine, they just want to get a little taste, definitely have them check out some of my videos. And then you can email me, themodernvet@gmail.com.
All right, we'll definitely y'all be sure to do that. Go check out The Modern Vet. And in the meantime, in between time, stay busy, stay active, make the most of every day, every moment, every opportunity. You don't know how many chances that you're going to get. Until next time, boy buddies, I appreciate y'all for joining. I hope that y'all picked up some good information. Thank you, Dr. Armstrong, for joining. Looking forward to having you again.
Absolutely.
All right, have a good one.
No rush, go on, move dumb. Back and forth, push and shove. Make your peace and love turn to peace and gloves. Now you got a deal run up. No rush, go on, move dumb. Back and forth, push.